Hello, everybody, and welcome back to another episode of the Big Bros podcast. My name is Ilan, and I'm joined by my lovely friend and co-host, but more importantly, we are joined by Dr Emma Richardson, clinical psychologist, and the current Tackle Your Feelings program psych. How's it going?
Hello. Thanks for having me. I don't know about more important. I think we're all equally as important as each other here, but I appreciate the kind words.
It's become like a bit of a running theme now where anytime we've got a guest, part of like the scripted intro we do is we always add the more important. And I've always kind of like, I started to think about it lately and I was like, is it really like necessary to say? But it's kind of started to roll off the tongue. I don't know if you feel the same.
Yeah, but you know, it's a very important and nice pickup from Emma there. So we'll definitely take that on board.
How's your self-worth though going, Jeremy? Like, I feel we're just dig right in there.
Straight in.
I'll tell you what, we've spoken a lot about people pleasing before on the podcast and where that stems from. So This is the first time we've had a clinical psych on, so we're bloody excited.
Yeah,
Awesome.
And Emma, if you ever want to just swap seats, you know, you can do the interviewing if you like as well. So
Very good.
Hey, for those that don't know you and the work that you do, how would you best explain that?
Yes, great question. So, as you said, I'm a clinical psychologist. I actually am based in Hobart in Tassie, and I've got a few different roles and things that I do. So the main job I'm doing is what you mentioned, which is program psychologist for the AFL Players Association and AFL Coaches Association's Tackle Your Feelings program, which maybe I'll explain a little bit more in a minute. So that's one thing I do, head up that program, and then I also do kind of traditional therapy, one-on-one stuff back at home as well, in a private practice setting too. Yep.
fantastic. So what is Tackle Your Feelings for those that don't know?
Yes, Tackle Your Feelings is an AFL, and actually we've moved into netball this year as well, based mental health program, and it's all about preventing mental health difficulties and also trying to get people to better understand mental health, to recognise signs and symptoms of mental health in themselves and others, and also then to know what to do, so to respond to those signs and symptoms once they notice them. And we go out into community footy clubs at all levels and provide that information, and it's delivered by psychologists. Sometimes we have ambassadors that come along as well. And yeah, pretty cool program. Been running since 2019, and we've now delivered to over 20,000 participants across the country.
One of the most fantastic things I think about like the mental health trajectory in Australia is that stigma has gone down. I think it's a different climate and landscape to what it may have been 10, 15 years ago. I am curious, footy clubs can have a lot, and just sporting clubs in general can have a lot of stigma attached. When you do go into these environments, where do you usually see most of the stigma show up? Is it more on the field or is it more in the locker room?
That's a good question. I think we've come a really long way, definitely, in terms of reducing stigma, which is pretty exciting, I think. When we go into footy clubs these days, there's so much more understanding about what mental health actually is, and even starting to pick up on some of those signs and symptoms. Probably still some ways to go, and I think it's quite almost club and environment dependent a little bit. So some clubs are doing amazing work, got incredible cultures, real psychological safety. People feel really safe, you know, to express themselves, to say how they're feeling, to reach out for support. But then there are perhaps some other environments, and I've heard this, you know, from players, coaches and so on, where we're not quite there yet. So there can still be little cones of silence sometimes. Sometimes it's to do with the clubs not fully feeling integrated with one another. So that might be between team levels. So, you know, it might be between youth teams versus senior teams. It might be between women's, AFLW and AFL. Some clubs are really integrating beautifully and some aren't. So I think there's still some ways to go within the club, and then out on the field as well. I think, again, things have improved, but as you would know, there's still a fair bit of heckling and things that can go on, often in good taste, but sometimes not. And we run the program with umpires as well. That's certainly a place where you see people cop it a little bit more in a not so friendly way.
Yeah. So do the Umpires Association, do they have also these provisional programs that are run through to the same extent as the AFL clubs? And how do they, I guess, manage it maybe differently to the AFL players because like you said, they can cop it a fair bit more sometimes than the players, right? So
Yep, definitely. And I think, and this is probably something we see across the board, there's a bit of a gap in resources between, what we've got at the elite level, the AFL, AFLW level, and what we see at community levels, and that goes for umpires as well. However, there are some good initiatives coming through, like our program, we offered to run that with umpires as well, and we've had good take up of that, at some community levels. But certainly when I've run and been out and run workshops with umpires, there is a lot more talk of that, spectator abuse and trying to manage that and cope with the realities of that than perhaps I've seen coming from players.
I'm curious about that, like as a psychologist who'd be working with umpires, and I always feel like for an umpire, it's a no-win job, especially in the AFL. It's if you make the right call, people will still get really angry and heckle you. Yeah. And especially if you're umpiring, there's 70,000 odd people. It's a prelim final. I remember the Jamie Elliott non-call, which was the spoil. Like, I can only imagine how much, heckling that umpire would have received. Mm-hmm. What is usually, how do they usually work through it? What's kind of a psychologist's role in that space?
Yeah, for sure. So, I mean, you're 100% right. I think it's a super tough job. I think the game is so hard to umpire for starters. I wouldn't want to do it myself. But as you say, then it's like lose-lose, because even if you do a really good job of the game, usually there's one side, or there's still spectators that are unhappy about maybe one call out of the 30 you've made in the game. So it's a super tough job. I think we really encourage our umpires and players as well to work on their mental fitness and try and be as really resilient as possible. And I think part of that is obviously trying to separate yourself out a little bit from those comments, understand where they're coming from, and know that it's actually not really about you as a person and your job, and get you as an umpire to look at, okay, maybe I missed a call, because mistakes happen, of course, but what about the context of the whole rest of the game, instead of just mental filtering and kind of seeing that one mistake that I've made? What about the rest of the game? How did I go? What about in the context of the whole season? How's my performance been? What's my feedback been from other umpires I'm working with, or the umpire or the coaches who are working to help me do my role?
So what I'm hearing is creating a more kind of balanced thinking frame, ultimately, rather than just being swayed by that one non-decision or that one, incident. I'm curious though, with resilience, a lot of players, it's one of the things they work towards, mental fitness. Mm-hmm. And when they hear vulnerability, they might think, you know what, to be resilient, I can't actually let anyone know that I'm in pain. I have to push through this pain, because that's what a resilient person does. How do you reframe vulnerability so that it can encompass resilience too, especially when you're delivering, the curriculum to players?
Yep, great question. And I think one of my favourite sayings actually is vulnerability is strength, because I think it's actually a lot harder to make yourself vulnerable than it is to, kind of push stuff down and put on that, like, I'm all good, like nothing gets to me type face, because when we make ourselves vulnerable, there's risk. There's risk there that we could get hurt. There's risk there that someone might reject us, or they might push back against us, or they might say, oh, what are you saying that for? That's, that doesn't show good strength, or what have you. So there's risk in doing it, which makes it scary, but it's obviously incredibly important. And I think we need to let people know and teach people that resilience isn't just about, being really mentally strong and able to push through, but instead it's about, okay, yes, sometimes I still get really stressed. Sometimes I still get overwhelmed. I get anxious. That's all normal. But it's kind of what I do with that from that point of view. And, resilience can be leaning on your support networks. It can be admitting, I'm actually not doing so well, and I do have good people in my corner. I'm going to, use that and let them help me and have that as a resource. Yeah. Do you feel like the resilience or and the stigma, we've got a bit of a spectrum there from resilience and compared to not opening up. Do you feel like that spectrum from not opening up to opening up is vastly different
in your clinic work versus the work you do in AFL programs, whether that's AFL clubs or AFL clubs at the grassroots level? Is that different? Does that look different and present differently compared to just your normal clinic work that you do with everyday people?
Yes, I think it can be quite different. I think in my setting, if I'm working in private practice, people are coming to me usually with a bit of an idea in their mind of what this is going to look like, and the fact that probably I'm going to have to open myself up here, to share what's going on with me so I can get the help, that I need. So I think there's already a bit of an expectation of, I'm going to have to be a little bit vulnerable here. It might be hard and it might suck sometimes, but they're kind of primed to do it. Whereas I think that's not always the case in footy clubs, because I think, as you say, sometimes people can get caught up a little bit in that mentality of got to be tough, got to be strong. Also, again, risk in vulnerability. What if I say I'm struggling and then, they go, well, are you right to play? You're going to be right to play in the seniors. Yeah. There's a risk of being dropped. There's all these things. So I think it's kind of set up in a different way. And that's why we want to almost try and replicate and create the same level of safety and the same amount of safe space that it would be if it was just you and I in a room, that it can be at a footy club, with your mates, and set up that culture where people feel really safe to be able to bring up, I'm not doing so well, and know that there's no threats or, risk of repercussions, things going wrong.
Yeah, you mentioned before that one of the ways that you see it present differently across the footy clubs is their relationships between each other, between the different programs at the club, women's program, men's program, youth levels. What are some of the other ways in which you see the really good clubs present their mental health protection, mental health prevention, mental health education? Is it through programming? Is it through social events? Is it through compulsory work? How does it present?
Yep. It's kind of all of the above, really. There's lots of good things the clubs can do, and as I said, some clubs are doing this amazingly well out there in the community. So they might be doing things like getting the Tackle Your Feelings program in, and that can be, so originally the program started for coaches specifically, and now it's across the whole board, so it's players as well. So that might be, for the whole club. It might be something like making sure there's nice social connection points. So that's team dinners, and I've seen some really nice social committees and things set up at clubs now that have a mix of players from all teams, from all genders, where they set up, team dinners and things like that, team movie nights. They might get an ambassador in or a past player, someone to come in and talk to the group. Other things clubs are starting to do at the community level, which is really cool, is set up wellbeing committees and wellbeing officers at their club. So that's something we've kind of tried to push through our program as well, because it can be really helpful. Again, gives people an avenue of, if I'm not doing so well, where do I go? Well, I know we've got the wellbeing officer. They can I can talk to them, or they can put me in the right direction. And then I think as well, making it really well known that the club's open to talking about mental health stuff. So just even posters and things up on the wall, of where you can go, where to access support, that can, I think, just provide more evidence that this is a safe space for this type of stuff.
Aside from the stigma, what's one barrier that you notice when it comes to players potentially not accessing mental health support?
Yeah, so I think stigma is probably one of the big ones. And I think it's almost moving a little bit away from the stigma of it's not a, good thing to do to speak up, or it's not a safe thing to do to speak up. But it's almost moved to like a kind of, I know it's okay for me to speak up, but there still can be a bit of a block there. Like I'm still scared. I'm still not sure where to go or how to do it, who to talk to. So I think that's kind of our next point, is kind of making sure people are well versed in, okay, I know mental health is really important. I know it's normal to experience mental health problems and it's really common, but what do I do if it's actually happening, or people sometimes feel a little bit scared around if they've noticed in someone else talking to them, because they're like, oh, what if they do open up to me and I don't know what to say or I don't know what to do? So it's kind of upskilling people, I think, at that next step is where we're at. Yep.
I think there's a real skill, especially as a mate. I know there's been so many wonderful initiatives in the last few years to, whether it's Are You OK Day, but yes. I think, like, my personal opinion on it is, like, the Are You OK days, they're great, but it shouldn't have just a day dedicated to it. It should be ingrained in kind of the culture and lifestyle. But, what is something you would say to someone who wants to be a supportive friend or a partner and help them support whoever it is going through ill mental health at the time? Because a lot of the time people might say, I don't want to become their psychologist, I don't want to become like their crisis support worker at that time, but how can I find that balance? So I suppose what would be some kind of helpful things to think about?
Yeah, so I think that's a great point. That people, again, there can be some fear there around, if I open this, is this a can of worms? What's this going to look like for me moving forward? Maybe I don't know, where to send people, or maybe I'll get stuck, as you say, like acting as a bit of crisis support or an ongoing support for this person, and I don't have heaps of capacity, in my life at this time to do that. So I think probably my recommendations around that would be, firstly, I think if you've noticed something, then I would say we all need to hold ourselves a little bit accountable and do something with that, because you could really dramatically change someone's life if they're struggling. You could make it so they get support and help and their mental health is much better. You could actually save a life by doing that. So I'm like, if you see something, let's do something with it. Even if it's not you personally maybe having the conversation. So if you've noticed, okay, this is my mate, he's not turning up to footy training on time at the moment, he hasn't really been engaged in the group chat, like he's kind of dropped off social events. What's going on? Something's off, and I'm not quite sure what it is. So you've got a couple of options. One, if you're in the headspace to be able to have the conversation yourself, so you think, yep, I know this person really well, I feel comfortable to go and talk to them, then have the conversation yourself. And when you're doing that, a really easy way to start that is just to talk about what you've noticed. So, I've noticed you've been late to footy training the last couple of weeks. That's so not like you. What's going on? Is everything okay? Simple as that. Or you've been a bit quiet on the group chat. What's going on? You want to have a chat, and then go from there. If you don't feel like you can have the conversation, then have a think about who might be a good person to do it. So is there someone who knows this person better than me? Is it another mate? Is there a wellbeing officer at the club? Can I go to them? Are they really close with one of the coaches? Can I talk to them about it? Because we want to make sure that it's not just missed in the busyness of everything else that's going on in life or at footy club. So you don't necessarily have to be the one to have the conversation yourself if you're not comfortable, or you don't have time and space and capacity to do it. But I still think we have a responsibility to make sure, that someone is aware and then taking next steps.
Yeah, I've got a burning question about that. And it's about the consent of that for the person, because
yes,
what happens, and I'm sure this presents a lot of times where, you're faced with a situation where you have noticed something is up, or you might even know something is going on, and they've said to you, don't tell anyone, I don't want anyone to know about this. And then all of a sudden you feel like the onus is on you to do something about it, and it is now your accountability, your responsibility to do something. In those situations, what do you do?
Pull up the APS Code of Ethics.
Good one. Yes, exactly. Really interesting, because you're right. And people do get trapped in these situations where they go, oh God, I can't break this person's trust. There's confidence in me. You essentially, obviously it depends a little bit on the circumstances, but if you're actually genuinely concerned about this person and you don't know what to do, or you think they need more support than you can provide, because we don't want people to go out there and try and be psychologists. Takes, as you would know, a fair bit of training to do that. Too long. So we want to make sure they're getting help from the right place. So I would be having a conversation with them about, I'd be really open and honest around that. And, you know, if this is a person that you know well, and or even not, most people actually, when you put things to them in you know, kind of the right way, will come around to that. So it might be around, you know, making it clear that, look, I really care about you. I'm worried about you. I want to make sure that you get the best support possible. And I don't think that I can actually give that to you. I think it would be doing you a disservice if I'm the only person trying to help you, because I'm not trained, you know, as a therapist, or I don't have, you know, very many skills in this area. I want to help you. But I think to do that, we're going to need to talk to someone else. You know, and if you're really concerned, you know, then you've got to weigh up sometimes what's the risk versus the benefit here. If I keep this to myself and something happens, you know, yes, I've kept that person's confidence, but it's going to be pretty nasty. So it's going, and I would tell the person, though, I wouldn't do that behind their back. I would say, I'm sorry, I think this is the point where we're going to need to talk to someone. I want to do that with you because together is better. Let's think about who you'd like to talk to. You know, it doesn't have to be anyone at the club. It can be one of your family friends. It could be, let's get you into the GP. But if they're still, you know, not coming at that, then I would say it's not your responsibility on your own to do this. You need to be supported as well. So I'd be like, okay, have a think about who can I talk to, and then make a plan.
Yeah, I think that's fantastic. So you're still essentially telling them what your course of action is, which is nice and transparent and open and honest. And with that, for, you know, the everyday person that, you know, that doesn't have that therapist background and is just the football player, whether it's at grassroots level or an elite level, do you have almost like a set of tools or tips that are really, really easy, really, really dumbed down, that they know about and that they can act according to when faced either with a situation where they're going through something bad or when someone comes to them with some information about them and they want help?
Yep. So I think probably a few things around that. So, I mean, most importantly, we want to kind of start just by acknowledging what's going on. So if this is someone that's come to you, or, you know, you've asked them, you know, I've noticed this about you, are you okay? Kind of acknowledge what's going on for that person. So thank you so much, you know, for opening up to me. Sounds like this must be a really difficult time for you at the moment. Let's talk about it and see what our next steps can be. I think just giving a person a little bit of space to talk through it in the beginning is really nice if you can do that, if you feel comfortable doing that, because often people will have held this stuff in and it'll be bottled up, and sometimes just giving the opportunity, it will want to come out. So just giving the space and not it's hard when obviously it's new to you maybe doing this, to try not to panic in your mind and think, oh God, like I don't know what to do, what do I suggest? That's okay, because you can work it out and you don't have to know right in that moment. You'd be like, okay, well, thanks, this is heavy, this is a lot. Let's, you know, work out what the next steps might be together, which I think then it's about going, okay, I need to maybe have a think about support. So that can be just getting them to link in with a support in their own network, so a family member, a friend, someone at the club. But we want to kind of expand the network of people who are aware of the situation and who can help. So it could be someone at the club, could be someone external. And I think for everyone just to know that going to a GP as a first step is a really good option. So if the person has a regular GP, that's great, because from that, they can actually do a few things themselves, but also they can link them in with a therapist or psych or counsellor or what have you to get some extra help that way as well. Yep.
Interesting, because I find that when you speak to people, I think nowadays it's a bit murky how to access those services, especially like a psych, because some believe you have to fork out a lot of money, and then you also have to almost explain to them that there's bulk billed options as well. Yep. There's other services available, and there's so many that are there for you. And I think that's the one really, really good thing about Australia, is that we have those services, and hopefully this is something that continues. On a different note though, I'm curious, because athletes are a very interesting aspect of the population. The way they think might be different to the general population. And as a consequence, they might have some unhelpful thinking patterns, and there's obviously quite a number of different unhelpful thinking patterns. Is there one that athletes commonly engage in, and is that different to the general clientele you see?
I think I would say humans, although we have our own distinct uniqueness, we're all special as well. We are very similar in terms of, the way that our brains work, because we've all evolved, from the same place in the same way. So I think there are definitely some common unhelpful thinking patterns and thinking traps that people can fall into, and it seems to be pretty consistent across the board. So I think, there's maybe about 10 of these that are super common, and if you ask people which ones, then you do get a bit of a mix across those, but it's going to be somewhere falling in those 10. So it could be some really common ones. I would say mind reading is a big one, which is basically assuming what the other person is thinking. So I could be looking at you guys and I could think, oh my God, they think that I have no idea what I'm talking about right now. But I don't know that. I've got no idea what you're thinking. I might just be going, I'm trying to pick up on some sort of subtle body language or some sort of cue that you're giving me, the tone of your voice. But in reality, the only way to know what you're thinking is to ask and then hope that you tell me the truth. Tell me the truth. So that's a common one. Another common one, and this might be a little bit more common actually in athletes, is shoulds. So getting stuck on the shoulds train, which is essentially where we kind of put a lot of pressure and unrealistic demands almost on ourselves. So I should never miss a set shot. I should go to the gym every day. I should be making myself a healthy meal every night. And you can see and hear in that how that can set up some unrealistic demands potentially of ourselves. And that when we don't meet those standards, then we start to beat ourselves up. Like, I didn't get to the gym today. I'm a failure. Didn't do that, which can obviously, spiral a little bit too if you roll on with that. So that's quite a common one of people who are potentially maybe a little perfectionistic, and we definitely see a bit of perfectionism in particularly our elite athletes. So that could be an example of a more common one.
Is there a thinking trap you get caught in?
No, definitely. I'm a bit of a shoulder myself. I'm pretty good at noticing it, I must say, which is the first part of the battle, really. If you can notice it, then you can kind of pull yourself up on it a little bit. But I definitely tend to hold myself to a pretty high standard, so I can fall into the should trap. Also, if you tell someone important to you, like I told my hubby about shoulds, both a blessing and a curse, because now, he knows about them, which is good, but also he'll pull me up. So he'll be like, oh, there's a should there. There's a should there. Yeah, okay, yeah. Which can be helpful and also maddening. Yeah. Because you're like, I know.
Very good. And then what is the solution for the shoulds?
Yes, good one. So with any of these kind of unhelpful thinking styles that you fall into, one of the main things that you can do is a strategy from cognitive behavioural therapy, which is called thought challenging. So it's kind of trying to look at the thought and then say, okay, how realistic is this thought? How accurate, how helpful? And then go from there. So with your mind reading, for example, where I've said, oh, you guys think I don't know what I'm talking about, we might be asking myself, okay, well, how do I know that? What evidence do I have that? What objective evidence do I have? I don't have a lot, actually. So just trying to challenge that a little bit that way. For the shoulds, I actually like to reframe the wording of that. So you can change it to I could, or I quite like I would like to. So I would like to go to the gym every day. Not I should, because that's not super realistic, but I would like to. Just takes a little bit of the pressure off. Same with I could go to the gym every day. But actually I have other things in my life that I also need to prioritise from time to time. And also, expand that, think a little bit about, how realistic is that. So also I need rest and recovery too. Like it's actually not good maybe for me to be at the gym every day, for example. Yeah.
How does it present for the player that needs to slot the set shot after the side to win the game, and they need to think, I need to kick this goal. I need to.
Yeah.
And what, like, do you train those situations with players? Like, do you train the particular situations of that, for example, and try to work out what they should what they should be thinking in those moments?
Yeah. So, I mean, luckily, and another good thing these days is most of the footy clubs have club psychs there so that they can access for these types of things. So there's a few things obviously they can do. Really, we want players kind of out of their heads as much as possible. And I think, like, sometimes, you can see those players who just play on pure instinct, and you're like, there's not much going on up here in that moment, which is actually quite a good thing sometimes, because the thoughts can get in the way. So we're going back to what's your controllables in this? What's your routine? Go back to your routine. You've done this 100 times. Maybe you're visualizing it as well. Visualization, really important tool in sport. So imagining it sailing through the middle. You might run through that in your mind. You've got 30 seconds, plenty of time to do that. Go back to your routine. Keep it as consistent as possible. Try not to let the outside noise in. Yeah.
Is that actually, like, just out of curiosity, is it, and it doesn't need to be evidence-based, but is that an evidence-based strategy in terms of visualization, or is it something that just works?
Yeah, a bit of both. There's some good evidence for visualization, definitely. Again, you've got to kind of find what works for you and what works, for the player as well. So for some, they might find that super useful, and for others, they might be like, no, I find it, a bit distracting for me or whatever. I prefer to just focus on, the feel of the foot in my hands or whatever it might be. But yes, there is some evidence base behind the visualization techniques. Yep.
Yeah, cool.
It looks so sick. I think about visualization a lot because I remember I was doing a placement at a hospital, like an inpatient unit, and I remember one of the group workshops, someone may have brought it up, like faking it till you make it, and asked if there's any validity to it. And I remember just saying the brain can't really differentiate fact from fiction. So if you start visualizing things, your brain's already under the assumption that it's happening. So your biology's kind of now orientated towards that. Your thoughts are orientated towards that. So I thought that's really, really cool. On another note, we had Dyson Heppel on last week or 2 weeks ago, and he noted that for a lot of players, retirement is a very scary proposition because a lot of their identity is tied to being the footballer. For athletes, I know there's a lot of conversations about, because the average career is like 3 or 4 years. So a lot of athletes are encouraged to do a university degree, a trade perhaps, or have something else lined up after football. What goes into cultivating an identity outside of your professional career, not just as a sportsman, but, you go up to someone at a dinner and you ask them, what do you do? It's so ingrained in our lingo. How is that conversation kind of encouraged in the work that you do to cultivate an identity outside of their work?
Yeah, it's super important. We have, so through the AFL Players Association who employ me, some really good transition programs and something we're continuing to work on to make sure we've got best practice transition for players out of footy, because as you say, it's actually for the majority of footy players, it's 1 or 2 years that they're in the system. It's not, the 10, 15-year career of the players, that we're used to seeing, that we love. So it's super important. And I like to think about the metaphor around having all your eggs in one basket. If all your eggs are in the I'm an elite footballer basket, and something goes wrong, you get a career-ending injury, or you just delisted because you're not quite at the level, the basket drops, all your eggs break, and you fall in a heap. So that can be your mental health might drop off. It can be your self-worth is majorly impacted by that. There can be a lot of shame around that as well. So we want to spread the eggs, which can be hard to, I think, swallow when you're an elite athlete in particular, because you go, but I need to put absolutely everything into this. If I don't put everything into this, I might not make it. So you can understand how difficult that can be for a young person, 17, 18, coming into the system to want to do that. But that's really what we have to encourage, and we have to try and obviously explain the importance of that to actually protect them longer term. So there's a lot of psychoeducation around that. And then it's like, okay, what else is in your life? What else is important to you? Let's look at maybe your values, for example, and work out, okay, who are the important people? What else do you want to build in here? So it might not just be about the elite footy environment entirely, but you might be like, okay, well, I'm actually also really interested in arts. You think Cody Waitman or something like that. Or cooking. You've got Christian Petrarca, for example, or I'm interested in social media. Okay, well, let's, look at at the same time as you're working bloody hard on your footy, as what course can we get you in, to start to upskill you a little bit, because we don't want our players leaving the system in a worse place than they might have been than their friends. We don't want them to be less well set up, than their friends who are maybe going out and doing uni or whatever it might be. They might have a little bit of income, from their time, which is great, but we want to make sure that they've still got transferable skills that they can use, and that they don't feel, that the eggs are broken and they're lost.
Yeah, and you almost see, like, you mentioned Cody Waitman, you mentioned Petrarca there, what they're doing outside. I feel like that's almost rubbing off on other players as well. Like, players seem to be doing more of that, really into, like, even if it's just posting what they're wearing on TikTok. Like, I know Paddy Lipinski does a lot of that from Collingwood as well. So just not being afraid to be creative, it seems like, one, it's rubbing off on other players, and two, I can imagine they're probably happier and they probably build a better culture for that. Is doing hobbies like that, is that encouraged through the programs, or is that just something that they kind of just take on board in terms of what they just want to do themselves, and they don't really need someone telling them that?
Yeah. So I think probably just by the nature of the way social media and stuff's gone, it's kind of happening a little bit naturally on its own. I do know that through the AFL and the AFLPA, there's a bit of training and stuff around different media. I know they had TikTok come out and speak to them last year, for example. So there is some of that stuff kind of going on as well, which I think, is useful and helpful. And there's quite a few resources available to them in terms of career development, career coaching. And I think that's kind of at the elite level. At the community level, Tackle Your Feelings has actually just developed a new workshop. So we've got the original Foundations workshop, which is all about the understanding, recognising, responding to mental health. We've got an anxiety workshop, which we released this year, and we've just finished writing a workshop on facilitating thriving, which is actually all about, let's identify your values, what's important to you, in footy, but also out of footy as well. So I think this space is opening up a lot more.
Yeah, amazing. We did speak about it a lot with Dyson those couple of weeks ago as well, because obviously he's working heavily with H, the label, and their clothing brand, and it is so nice to hear about someone that was that player, doesn't necessarily need to be an elite player, but was that player, but is now getting recognition for doing something else in the community, doing a hobby, and it's now become, as he said, a massive part of his life, and it's something that he wouldn't be able to imagine his life without it. So it's great to hear that it's becoming more of a common thing. As a psychologist, and as the work that you do with football clubs and with players, is there a success story? Is there an impactful story? Is there just a story of meaning that sticks out to you more than any others?
I think for me, it's really like just hearing when clubs come back to us. Like, we get a fair bit of feedback, obviously, from community clubs that we've been out and delivered in. And we've got a large network of psychs because we obviously deliver all over the country. So we get a fair bit of feedback about what's gone on at the clubs and maybe what the changes are following that. And I think it's just, those comments when people come back to you and they say, oh, I was able to have, that conversation, or look, I've actually accessed a psychologist now and it's made a really big difference, or I feel so much more comfortable, at the club, or having these conversations. It's just those little, I think micro changes that are going to make a big difference long term. And so I love, to hear that feedback and, how well it's kind of going out there in the community. I think it's just growing, which is really cool.
Do you see a mental health round coming in the next few years?
I think it could be on the cards. A bit like you said earlier around Are You OK Day, which I think is a great initiative. Again, we, of course, just want to make it an ongoing focus for people. We want people to always be kind of, checking in with themselves, checking in with others, have it part of just what you do, make it a bit more habitual. But I wouldn't be surprised if we saw something like that come in. And I do think it could be really cool. Like, I think they could do a great job of it. I think about, the big freeze with MND and how much awareness that raises. And I think that permeates the whole year as well. I don't think it is kind of stuck to that one round. So if they can do a similar thing with a mental health round and make sure the message is spread and kind of continues throughout the year, then I think it could be a good initiative.
Yeah, I think there was so many wonderful ambassadors. Like, I know Tom Boyd's done awesome work in that space, and a lot of players, I think, do recognise the need and the necessity, maybe not necessarily for a mental health round, but more support. And I think also just with more research coming out about concussion and then unfortunately the links with CTE, there's more awareness, which is great. And part of me wants Australia, especially AFL, to be that pioneering code that drives this message forward, because I think it's so crucial and there's so much brilliant work that can be done in that space. Hey, before we wrap up, I want to quickly just ask, what's on the lookout for Tackle Your Feelings? What's in store for the next kind of few months?
Yes, good question. So our kind of season follows the footy season pretty closely. So we're kind of coming to the end of most of our workshops for this year, and we're kind of in program review stage. So going back through our programs, checking in on feedback, making adjustments, and finishing off that new workshop that I mentioned. We've run 216 workshops, I think, this year, about 180 odd of those in footy and then the others in netball. So we've built each year, so looking to kind of continue to expand on that. If people are interested in knowing more about Tackle Your Feelings, you've got a couple of options. You can email us at info@tackleyourfeelings.org.au. You can also follow us on social media, which is at TYF_AU. And we have some good resources on there, as well as on our website. If you're a club and you want some good resources around, the values, there's some grief resources, all sorts of things up there. You can go to our website, which is www.tackleyourfeelings.org.au.
Perfect. Thank you so much for coming on. We'll attach all the notes in our show notes, so the website, Instagram, and so forth. Thank you so much.
Thanks for having me. I had a great time.